So what are uterine fibroids? I'm just going to give an overview of what fibroids are and the general principles for their treatment, and then in subsequent talks I'll discuss the specific treatment options so you can make an informed decision when you're seeing your doctor. Fibroids are the commonest type of tumor that you can get in the uterus. The word tumor just means swelling, it doesn't mean cancer, and they don't become cancerous. It's very, very unlikely for a fibroid to become cancerous. Women have a 70% risk of getting fibroids during their lifetime. There's another type of tumor you can get in the uterus, which is known as a sarcoma, and that's a uterine cancer. And the risk of that is much, much less than a fibroid. It's 7 in every 100,000 women. So these are the biggest risk factors for fibroids, primarily race, age, and an early start to periods. The number of children and genetic factors, definitely with genetic factors because we know there's a large hereditary component to getting fibroids. Caffeine and alcohol don't really have much effect. Obesity also increases the risk because you're more likely to get fibroids as a result of the extra estrogen that's produced in the fat tissue. And medication, for instance, if you're having fertility treatment, promotes the formation of fibroids. Fibroids are classified as 9 different types, really depending on the relation to the muscle of the uterus. 0 is the one that's pointing on the inside of the canal on a little stalk. Type 7 is the one on a stalk on the outside of the uterus, and type 8 is the one that we know where you have a fibroid that's away from the uterus, what we call a parasitic fibroid. So when you get fibroids, what can happen? Well, they can grow, or they can get smaller, or they can stay exactly as they are. They don't necessarily have to do one or the other. If you don't have any symptoms, you don't need to treat them. If they're small and not causing any problems, they may stay exactly like that for the next 20 years, so you don't need to treat it. The main indications for treatment proven in what we call randomized trials, which is proven benefits from having the treatment, are for abnormal bleeding and for what we call bulk-related symptoms. So if the fibroid is very big and pressing on the bladder or something like that, that increases the need for treatment. Unproven indications are things like having fibroids removed or treated to improve fertility, preventing difficulty with childbirth or pregnancies, and then for assessing for possible malignancy. These may help, but we don't have definite evidence that they do. There are many ways to manage fibroids. The first is what we call expectant management, where if the fibroid's not really causing any symptoms, you don't have to treat it. You just do a scan every few months to check the size hasn't changed and maybe do some blood tests, but nothing more invasive. The next is where you can have medication to either treat the symptoms from the fibroid, such as heavy bleeding, or to try and shrink down the fibroid. Now, there are lots of different medication groups that can be used for this, and I'll discuss this in another video. Another option is what we call radiology-based, where you can have procedures to try and break down the fibroid to shrink it down to about half its size. Lastly, we have the option of surgery. If you want to remove the fibroid, it can be done either with open surgery or with keyhole surgery. We obviously tend to lean more towards keyhole surgery now because it's safer and there's a much quicker recovery. I'll be discussing each one of these steps in subsequent posts. Thank you for listening.